Welcome back, everyone. In today's video, we're going to post a live surgery we did during a course, a hands-on that we did at the course. It's 2 implants immediately placed. One is in the maxilla, one is in the mandible. One required a tissue punch, and the other one was able to be done with an AGD technique, the apical gingival displacement technique. The audio is a little bit poor, so forgive me up front, but I think the content is going to be well worth your time. When you get to the end, give me some comments. Let me know what you liked and what you didn't, and we'll go from there. So step 1 is always the same with the healed site. Is we're going to come in and we're going to roll this mucosa here. So I'm just going to use the back side of this line. And it's actually pretty low again. We got lucky again. So it's down here, right? So let's go ahead and verify this. That's our first check. But our second check is going to be after the guide goes in, where is the actual site going to go? Okay? So the guide snapped in, really nice, right? So we're going to check to verify that it's seated. I'm looking from an angle view here, and it's perfect. It looks great there. Looks great there. You can go behind the guide and look on the last tooth area here and make sure it looks good there and there. So the guide is perfect. And I'm going to look in the hole. That looks good. So the way you can, this guide is not touching the tissue like yesterday. So what I'm going to do is I'm going to come in with the tissue here, and I'm going to actually slide it into the master cylinder, and I'm just going to apply a little pressure. Okay, so I'm going to apply a little bit of pressure, just apically like that, right? And then I'm going to come out, and I'll show you. We should have created a little weep line. Do you see the little weep line? I don't want to start the tissue punch yet because I want to change that position. Let me see if I get it to the, there you go, guys, sorry. Right there, you see it? So it's perfect because if you look to the buccal, do you see how much keratinized tissue we have in the buccal? So we don't have to do anything but a tissue punch. That's great because that means, Andre, you can go do house chores this afternoon. With Olaf tells you that you have to. All right. Okay. Put it back down.
Oh.
24.
That's no 28 for the 11 sites.
Notice when we put the surgical line on the back wall. What I'm trying to do, guys, this isn't how I do dentistry. This is how I get out of the way, as you can see, section. So I'm acting. Okay. Okay. And that's it. There's a little tag on the lid there still. Good. Now, just a little gauze. And guys, I'll give you a chance to see this. We've removed the tissue tag.
Flip it around. Suction. Yeah.
There we go. So look in the mirror. Don't look up top, but look down towards the bottom of the screen. You see where we've got the weep hole there. That's perfect. So now we're going to step through a little bit of salt water, a little bit of vibration, come together outside of the mouth. Tip goes in, then I wiggle the guide sleeve until it seats in the master cylinder. And we'll switch hands again, guys, so that you guys can see. Very good. Okay, so yellow is the first then, that's the 2-0. We switch it over quickly so I don't have to think. Wiggle, wiggle, wiggle. And that's what the guy's thinking to a seat. Okay. It's seated, and I say, Sarah, are you down? Sarah confirms she's down. Once that one's done, I gotta get it out of my surgical field so I don't use it again. Looks like we're going one way. You too? Okay, now, let's see if we can see something here. Look carefully here. Get this guy to the other way. That's what you want to see, guys.
Looks great, that's a red bone.
Pink. Mm-hmm. That's exactly right. So we're going to switch speeds. Speed is switched.
We are SP4, yellow to gray.
We're going yellow to gray, so it's so
Margaret, can I get a yellow to gray? Yeah, what drawer? It's in the cabinet. Here's one, but it's the screw. Want to do that one? It's fine, we'll use this one next. Sure. Yeah.
Here's okay. So this is the bottom is yellow, the top is gray because the implant diameter is yellow, which matches the master cylinder, but the top of the implant is going to be gray. So when you look at the implant, that implant's gray. So the interface is the top of this driver. And insert them together. And then turn the knurl, not too tight, just enough to pick up the implant. This is the nice thing about this, is that I have control over the implant. I can carry it to the mouth and very accurately put it in position. Okay. Speed is changed, confirming speed. Speed is changed. Stop position again. SP4. You sure for it? No. You never use it. So we're just, okay, so we torqued out there, guys. That's great. So we're about 1.5 millimeters away. So Andre has great bone. So what we're going to do is we're going to do the exact same thing we did yesterday. I think I can clear the guide. So what I want to do is I want to back it out just a little bit first. 1, 2, 3, until it feels like it's a little loose. It's a little loose now. I take the driver out, turn it over, reinsert it, and now I'm going to drive it home a little bit further than the last time. Until I feel like I'm getting a fair amount of resistance. And that's pretty tight, so what I'm going to do is I'm going to back it out again. Now it's a little loose, and I'm going to go a little bit further apically this time than I did last time. This is the bone, dense bone cortical. Now I'm watching very carefully here with my eye, and voila. We are perfectly placed right at the right depth. Let me see if I can show this from a buccal view for you. You get this perfectly level for you there. Okay, so look in the mirror. This the little groove, it doesn't have a snap link on it because it's the last groove, the closest to where that little dimple is. That groove is right at the top of the gut master cylinder. That's all you need to know, and you're done. That's perfect. Okay. So this knarl gets stuck, you can't undo it. All you need is an 050 driver. It goes right in the end, and then just with counterclockwise direction, you can unscrew it so that becomes loose. Now, if this is stuck, that's okay. That's what you expect. Try to take the whole apparatus off together. Okay, just wiggle the whole thing together. I think my screw is completely loose yet. There we go. And that's why. And so when you use the screw and you got to unscrew it all the way or it won't come out. All right, Andre, the first one's in. We're done with the first one. It's pretty fast, huh? And for a screen, cover that bolt, and we have some pickups already. Always identify where your pickups are. We like to put them in the exact same spot every time. So stock 3mm tall filling buttons goes in. No rotational forces. The easiest way to do that is, oh look, my ball burnisher. See this? It's a double-ended ball burnisher. Either end works. I like the bigger end because it fits a little better. So that just creates an axial force, right? So what you don't want to do is you don't want to do this off the side, right? And then look, just rotation. It's going to go in all by itself with no force because it's a highly precision machined piece of equipment. Once it engages, there it goes. Yep. So it's not engaging, so she's going to suction out the hole. I'm going to view it, make sure that there's nothing in the way. You just might want to be a bone profiler. And I'm going to try one more time. If it doesn't engage readily, what we're going to do is grab the bone profiler. That's not engaging readily, so we're going to grab the bone profiler, which is great because this way you guys get to see that again. This is the abutment that goes with the bone profiler. Okay, light finger type. Trephine, specifically designed to pair with that. See, it has a little bit of debris there. Throat screen's intact. Driver goes in. Profiler comes out. See how narrow the profiler is? That it allows you to get past the bone that's in the way. Healing abutment's on. 3mm tall healing abutment. All right. And then it's just a firm turn, and that's it. Little gauze. And there you go, guys. Right? Pretty straightforward. And then you can see all of this beautiful bone, or all this beautiful keratinized gingival on the facial. So you get that view again for you. So you can see how much keratinized gingiva is over there on that side. Yeah, that's right. Good. All that keratinized gingiva on the facial there that we're working with. Look at that. That's great. All right. So I'm going to move to the bottom now. And it's the same procedure, just on the bottom. Step one, we have a healed site, we need to roll the mucosa. And in this case, we don't have enough. Okay, so we're gonna do the AGD technique. Can you see that? Oh, my hand's in the way. Let's see if I can roll it
You
this
know
way.
how we did the seat yesterday? You wanna do it?
I can try, yeah.
You know what I'm saying?
Yeah, let's try. I'm gonna move you around just a little bit for a second and change your position. So you're sitting up a little bit more. Bring it down.
Here's that trash can.
You're fine.
You can just set it in there.
Thanks. Give me a second. Okay. Turn a little bit towards me. Good, and down. How's that?
And then we just raise it, yeah, bring the subject matter closer to the top. Let me see if I can do this without being in the way. Can you see it now? So, we're rolling it. If you want to come closer, you guys over my shoulder, you can see it even better. So you see how we're rolling it? See how obvious it is? So it's just, yeah, it's just too close. It's probably, if I did it with a tissue punch, I'd probably have a millimeter of tissue, right? And that would get me a solid C on the case, and we want an A. So we're going to go ahead and do the gum job. Sorry guys, you're not going to be able to see a whole lot with this lower one. And that's why most of the cases you see that we present in the course are on uppers. Okay. Mid-facial, intrasulcular. Okay. So let me see if I can show you this in the end.
Straight after
Can you see it okay? Let's see. Let's see if I can do a better job.
Perfect.
Okay, so you can see let me see if I can show you. We cheated it towards the palate, but it's hard to see in the mirror here. So we cheated it towards the palate like we talked about. All right, now, a little bit of pressure here.
Just stay biting, okay?
And that's it. Okay? So, show you again yours.
That's great.
And that's the flap right there. So I'm going to hold it just like this. Sarah brings the surgical guide in, and it seats perfectly. Now the fact that it's seating perfectly has a lot to do with the team here making these guides. Okay? If you don't have the right guide manufacturer, 21's the length. I'm looking at the back table. So we're going to start with 21. You'll have, it'll be more like a night guard, and it'll be very tight. So you just have to work with them and tell them all the time, don't make it that tight.
Or use us. I've been really big.
Just
Big,
a big
big,
opening
big.
to start with.
Big.
That's it.
That's it.
And then when I get this out, you can relax.
Big. Big.
I'm just following the 21 drill length straight across, right across this 21 row until I get to the blue.
Open big.
You see how I don't have to read the signs because of the yellow stripes? So if the guy's that just lets me know that's the small end and that's the big end, so I don't have to think. I know the next one's there, right?
That's gonna be your last one.
Thank you.
Open big. Last time, okay, you're doing great.
Now, let me just show you something, guys. just as a learning point. If I put this in here like this, and I try to get this in here, I cannot get it in there with his teeth, right? It's gonna hit the opposing tooth. That's why you have to do this and this on almost everyone. And that's why people say, I tried guided once and it didn't work for me.
Method make it.
Yeah, it's not us, it's the method. All right, so
SQT.
the drill sleeve is blue, the platform of the implant is green. So blue is the guide sleeve, green is the implant. Stop position 2. Changing speed. Oops, I went too far. Okay. Confirming speed's changed. Speed is changed. You're gonna yell it out loud twice. You don't want to be the guy who just in at full speed. All right. Bring the implant bring the head to the back of the mouth, past the opposing dentition. Make sure you guys are watching and paying attention now. Don't sleep here. Come past the opposing dentition and then rotate. Do not try to come in like this, and this will fall down the mouth. Okay, come in like this. Gravity's still working for me, working for me, working for me. Now I'm in the hole. Okay. And it's got great bone out the gate. We're at 40 centimeters.
Jeez.
Subcrestal.
That I don't have.
Okay.
So we're going to go subcrestal right away because it's a healed site. I'm trying to take this out without loosening my guide sleeve. It's sticking on the guide sleeve.
I know. That's my job. I should have known better.
Do you have another blue guide sleeve?
I do. On my desk, there's a container that says guide sleeves. Did he home weld it?
No.
Yes, please.
Cross kit?
Thank you.
You're the driver. So you got the cup for custom. Never had that happen before either. It's interesting. So the guide sleeve slipped out of the guide. That can happen because the glue is not great, the press fit's not great. It doesn't matter because we're going to just press fit and do one in. It doesn't have to be bonded into position. Then grab our subcrestal driver. So this one has a little bit more narrow here, and that's the gut driving the guide portion there.
Really big.
So I'm not engaging the implant quite yet. I have to rotate to drop into position. So watch it drop into position once I engage. There we go. So I dropped into position, and now it's drawing perfect. And we're perfectly down. Okay, so let the guide sleeve didn't engage. Go ahead. It didn't hang up on this one because you're using subcrestal, so it doesn't bind. So it comes out better. We had 47 centimeters of torque. I don't know. Let's give it a try. We're going to go ahead and put our abutment in and see if it seats. Throw screws in place. 3 millimeter tall regular. Yes. Don't move on, Dad. We're going to pick this up off your tongue. Okay. And we're going to go with a bone profiler. We need a blue bone profiler. Broski.
So is the bone profiler, does it correlate with the implant or the platform?
Platform. Okay. Spit that out. Spit it out. Spit it out, Andre. There you go. That's twice in the same day. Sorry about that. That was good work, team. All right. So the green bone profiler goes in. The matching trephine goes with it. Goes right over the top.
Caffeine was had yesterday after
Apparently. All right, bone profiler abutment's coming out now. And that's that. Abutment goes in. And this is a great case where I would use my ball burner because my fat finger would be in the way. Okay. And we're done. So we're done with the implant. Looks great on day. And what I'm going to show you guys here is that this tissue right here is a little mobile. Okay. So I don't like that. So since it's a little mobile, we'll go ahead and just put a suture in there. So I'm going to elevate just a little bit more to get into the mucosa here. I want this a little bit more mobile in this region. So I can get it more apically displaced. Oh, that's great. This is PGA. I really like the PGA product. It's braided, so all your braided sutures are going to be really easy to work with. So we're going to do a horizontal. Yeah, these are my new favorite pickups. Did we get that number for the slides? I don't think we did. These are some new long, skinny pickups. They don't have any teeth on them, so they're just gnarly, but they're really great for soft tissue work. I just came across them. I just came across them recently at a trade show.
He loves them.
I do.
You can feel a little bit on the inside. We're done. This is the last little bit, so you shouldn't feel anything else.
If it hurts, it's Sarah's fault.
One little pinch, and then we're all done. Yep, that's it.
So it's wanting to go back over the top, right? So we need to get some digital pressure on it to kind of apically position it. Go ahead, Sarah, put a little pressure on that. So I don't want to get the suture too tight. I just wanted to hold it, push down apically on the side so it pushes that flap into the rest of it. Yeah, that's good. Just get it so it's not on the abutment on the facial. I just need to make sure I don't get it too tight like this. That's good. So we do 2 throws, one the other way and then one the other way. So some plastic surgeons not. Okay, so we're done with that. Now the tissue's still mobile. The suture's keeping it from moving apically, but it's not staying apically. It wants to go back to its home and go down. So Sarah's going to put some pressure on it for about 2 minutes to get that initial clot to form. And we're going to look at it and make sure that it's down before we let him go. So you want that flap coming back over it inadvertently. So just a little bit of apical pressure on the gauze like that until it sees properly. By this point, if we were to go back to the top and look at the top, it's not leading, right? So you can see how beautiful that is for the patient. So the top is in really good shape there.
Here's the first one.
Alright, can you get one where you can show the proximity of that to you?
Yeah.
You drag that piece of debris here. So. Great. Pretty close, huh? Now you might say, well, it looks like even apically you're even touching it, but that's a three-dimensional projection of a three-dimensional object. So it's not doing that. In the three-dimensional space, you'll see that it's perfectly placed.
You can see it better on the images up there.
Yeah, see how close it looks like it's here when it's projected? But when you actually look at the three-dimensional, it's not doing that. So guys, upstairs, what we're doing is just taking the final 2 radiographs. Ooh la la. Looks pretty good, huh? Yeah.
The brown already looks better. If you guys want to do that too.
Any questions from upstairs? You guys can see
Can you see that, Dr. Rowe?
the gumdrop really nicely there. So by putting that gauze on there, we're really pushing that tissue down into the vessel to get it to stay, so it gets that initial clot. Just keep the gauze in for about 20 minutes with light pressure, and it'll be fine.